All right, now you're not unaware that we've been having a number of health issues beside that of COVID-19 that we've been battling with since the beginning of this year. And of course, we knew it was happening. It came. Every nation was definitely least prepared. That was that. We're still struggling with it, still battling with it. And a number of nations are already in a second wave. But what seems to be making a second wave in Nigeria now is yellow fever. And a good number of states in Nigeria have had their cases. How are we dealing with this? Let's begin with an epidemiologist and a virologist and public health epidemiologist. He joins us from our studio in Abuja, Dr. Akiala Ishaku. Thank you so much for your time this morning, and thank you for joining us. So, first of all, we've known this since like 2017, and just what do you think we missed with all these new waves coming on?
Thank you, Ayo, and thank you, Ayo, and thank you, Kayode, for having me. I think we are experiencing an epidemic in a pandemic. We're experiencing a yellow fever epidemic in a COVID-19 pandemic. And I think that just like the way you established the background, in 2017-2018, we had an outbreak of yellow fever among the nomadics in Kwara State. Although initially there was denial that it wasn't a yellow fever, but when the National Center for Disease Control and the National Primary Health Care Agency went into active case search of suspected cases, samples were collected, and it was revealed that it was actually yellow fever. Now, in this global pandemic of COVID, we have seen patterns of spread around Delta State, around Enugu State, around Kogi State, and also around Bauchi State. So what did we miss? I hope you know that yellow fever is a vaccine-preventable disease. In fact, it is not even listed among the diseases of public health importance because, you can use vaccines to actually tackle it and then bring it to a halt. So where did we miss? We missed in our vaccination, immunization strategy. Once you take this vaccine, a short dose, you will be rest assured that over a lifetime, you can have an immunity for this disease. But we end up seeing adults coming up with the disease. So I think quite significantly, there are people that have missed the yellow fever vaccination timeline. So I think that what we need to do is to encourage mass vaccination and begin to have a target to that.
Well,
secondly, the vector that is responsible for yellow fever.
We'll solve the problems, Dr. Ishaku, but there's something that you said now that I think we need to address because it sounds like it's a systemic thing. It sounds like it's a process thing that we missed. You said just now, and data also reveals the same thing, that adults are coming down with yellow fever. Some have died as a result of it. In fact, part of the data released by the NCDC indicates that people are as old as 35 have also died as a result of yellow fever in this current trend. So then, that would suggest that if the last time we had it before 2016 was 21 years before, it would suggest then that we started dropping the ball more than 21 years ago. That sounds like a systemic thing. What's the assurance that if we, just as you said, solve this problem now, we vaccinate everybody, and it goes away again, what's the assurance we have that a repeat will not occur in another 2 decades from now?
There's an audio. So I think that so it is. I agree with you that it is systemic thing, and I quite also agree with you that we need to do a lot of studies. Kayode, what it is lacking, apart from being a systematic reoccurrence kind of a pandemic, is that we have missed. We have actually missed certain component of it, which is research. Now, beyond that, we also need to also check vaccine efficacy beyond being reoccurring as a systematic thing. Ayo and Kayode, in the early 70s, through WOSU, Nigeria was given an accreditation by WHO to start manufacturing yellow fever vaccine. And Nigeria was producing that vaccine through the Public National Health Reference Lab in Yaba, Lagos, for the whole of West Africa. We lost it. Now, these vaccines that we are getting now, they are coming from Europe and other parts of South America. Have we done immunological studies to look at the vaccine efficacy, even among our population? Have we also brought in entomologists, because the vector that transmits yellow fever is actually a mosquito. So I want to commend entomologists in the Arbovirus Research Institute in Enugu for doing a lot of studies. But can we also check whether there is also a speciation of these viruses, of these mosquitoes in these areas? So we have a lot of things to do. We must not wait that after 10 years, after 20 years, after 30 years, we begin to have a cyclic reoccurrence of these diseases. These are vaccine preventable diseases. So we need to come up with a national policy on even addressing most of these things. Ayo, we are underestimating a lot of diseases, hemorrhagic fever diseases. We are not talking, in fact, we are underreporting hepatitis E. Because hepatitis E, hepatitis B, yellow fever present the same clinical signs and symptoms with yellow fever. So what we just need to do as a nation to avoid the reoccurrence of this is actually, we're in a 21st century that is knowledge-driven. We need to pump resources into research. We need to go into research to actually see whether these mosquitoes that transmit this yellow fever have actually undergone some mutation. Actually, or we could also see whether the global warming has actually affected this species population density.
You know, on that issue of research, let's try to explore that. Pardon me, Dr. Shaku. I mean, let's explore some of the issues you have raised. And we have joining us this morning also on the program, Dr. Oyiwana Godwin, who is a Supervising Commissioner of Health and Human Services, Benue State, and also the Commissioner of Energy, Science and Technology. Good morning, and thank you for joining us on Sunrise Daily. I'd like to take you up. We'll come to what's happening in Benue State in a moment. But Dr. Ishaku, our guest in Abuja, raised an issue, very important issue, regarding research. Now, I know that science and technology is also your area of supervision in this state. So regarding that, just how much research have we carried out into yellow fever, the vector that spreads it, how much mutation has happened, how we can stay ahead of this epidemic, as he has put it pretty much? Just how much research have we done?
Well, thank you so much for having me this morning. The research that we have done, as far as Benue State is concerned, is a bit elaborate. This is not the first time this disease has been coming to Benue State. I think as far back as 1986, there was this massive outbreak in Oju local government area of Benue State. And since then, the Benue State government have taken this matter to the level that it ought to be. And then in the year 2019, there was still another outbreak in about 3 local government areas in Benue State. And since then, the governor of Benue State has really developed a keen interest. What can we do to checkmate this virus, viral hemorrhagic fever? And then the vector, what can we do at least to checkmate it? And then if it is bringing a lot of mutants. What can we do? So we actually sent samples to various research laboratories. And then, as we are talking right now, research is still ongoing. The best way, and what is the best where we can do to curtail if there are mutants that are coming up? Why is this thing resurging in Benue State? And until we get the result of our findings, we cannot come out with any definitive solution for now. But we are not resting on our horses. We are doing something to make sure that this thing is curtailed and then brought to the barest minimum. Thank you.
All right, Dr. Godwin, we will be back to you to continue this conversation after this. Thanks for staying with us. Doctor, you want to, well, the explanations you have given, would probably give us an idea of how government has handled this matter over the years. But then I'd like to ask you, this outbreak that, according to information available, has taken the lives of 20 valuable Nigerians, and that of the 80s that you referenced, any similarities in the way we handle them and the way it's coming?
Yes, the way we are handling this present, and actually the number that you just brought up now is less than what we have right now. As of yesterday, we have 53 deaths, 53 altogether, and then the number of deaths in the hospital is 25, and then the death in the community is 28. The way we are handling it now, this RCCE pillar, risk communication and community engagement pillar, we are trying to step it up. When this thing came up and we had a report that 17 deaths were recorded as at 11th of November, the people thought that it was something else. They had this superstitious mind and prejudice that the gods were angry with the community because some youth stole something. And then this pillar that we erected went round in a quick response being set up by the Excellency, the Executive Governor of Benue State, to find out what is really the problem. So the team first went to that place in an emergency response to get the feedback from the people and then carry out sampling. We discovered, the people that went there discovered certain things, that this thing is ranging between 15 and 35 years, and mostly males, those 17 deaths that were first recorded. And then they begin to wonder, what really happened? And then the people brought up this kind of superstition I talked about. But the suspicion, after carrying out verbal autopsy, proved otherwise. The verbal autopsy that was carried out, they began to suspect something else. They began to suspect that it's viral hemorrhagic fever. We interviewed opinion leaders, community leaders, religious men, traditional rulers in that community. The name of that community is called Epidemic, in Ogbaribo local government area of Benue State. So they actually went further to find out what is the source of water that these people have. And the environment as a whole, the kind of symptoms that the people that were dying displayed before they died. And then the people that are alive, that are suspected to have the virus. And then it was suspected that what actually the people had was viral hemorrhagic fever. And then they took samples and took it to the National Reference Laboratory of NCDC. I think 2 days on the 16th of November, the result came out that it was actually yellow fever. So when the result came out, we mounted up very massive campaign to the people that it was not what we were suspecting. It is yellow fever. We met with different kinds of communities.
Right.
Yeah.
I understand. We'll get to some of these measures you're putting in place in a moment, but it's quite interesting, really, because if you say that the oldest is 35 years to have died from yellow fever, and you said that there was an outbreak in 1986 in Oju local government area, 1986, that's about 34, 35 years from now. But my challenge with all this is, you said that a lot of them thought that this was something diabolical, something from the gods. The gods were angry. And it begs the question, if there was an outbreak as far back as 1986 and there were subsequent, sensitization across the states, why would people still attribute such deaths to diabolical means of the gods if they had knowledge? So that begs the question, was there indeed some form of sensitization over the years for people of those local government areas?
Yes, there was, there are certain communities that once they have an opinion, sometimes it's difficult to change their opinion. When this thing happened in 1986, I think I was still in secondary school or thereabout, I knew that even as far back as 1986, people were coming, even white men were coming, and they were they released a lot of pamphlets to the people that we should take care of our environment, take care of the kind of sleep that we have, distributed nets, and then did everything possible to make sure that the water sources were corrected. In fact, they sank boreholes, and the people actually were made to understand that this thing is not the kind of thing that people were expecting. And then even last year, again, like I told you, it happened again in 3 local government areas in Benue State. This massive campaign also came up again. And each time, the government is taking measures. The measures that the government, especially that was last year, the government took adequate measures in conjunction with our partners, UNICEF and Govt, and then the government mobilized resources and campaign massively that the people should take care.
All right,
now,
Dr. Iwana, we'll need to take on Dr. Shaku, but in a moment, I just want to find out, how does sinking boreholes solve the problem of yellow fever?
The water that people drink. Let me tell you now what is really happening in one of the local government, one of the communities that we went to. The water that they drink, actually they combine it with cattle. Cattle come to drink water from that source. Human beings go there to drink water. And this vector, the vector that is transmitting this virus, is a mosquito. It's mosquito. They call it Aedes aegypti. And they lay their eggs in rotting environment. That kind of environment that you see, that kind of stagnant water that they do drink, they lay their eggs in such an environment because they emit this kind of odor, the kind of acidic odor that they use in multiplying their eggs. And when the eggs are multiplied in such an environment, people go there to fetch water from that same place that this vector is multiplying their egg. When they drink this water, of course, they will be down with this viral hemorrhagic fever. So water is an important source of transmission of this vector, especially stagnant water and very dirty water. That is why source of water is very, very important.
Right.
So if you take care of the water here.
Okay, so it seems you just pointed out to 2 major issues. So let's go to Dr. Shaku in Abuja studio. So he's talked about, that's the Commissioner for Health in Benue State, the Supervising Commissioner. He's talked about, people and their beliefs, that this may have influenced what we're seeing now. But then he also talked about water. And I mean, you understand that for a lot of these communities, the government is meant to be responsible for providing potable water such that they don't have to go to areas that are mosquito infested. So really, when you weigh these realities, who would you say takes more of this blame in what we're seeing now? The people or the government?
So, Ayo Kayode, in the 21st century, we are discussing about water provision. It's supposed to be the responsibility of government at local government level, even at the state level, not talking about the federal level. So in the 21st century, we are talking about water provision. I think it is archaic. So I will blame the government for this. But by and large, you will discover that water plays a critical role in the transmission of yellow fever. I quite agree with that because water serves as a source of breeding ground for these mosquitoes where they lay their eggs, but in a stagnant water. So we are not supposed to have problem of provision of water within the middle belt because the river Benue basin serves as a tributaries for us to also create artificial dams, for us to also create potable drinking water for people. So I think it is quite key that we see this as a responsibility of government, and government need to sit up to look into that. We must not wait for partners to come and help us in provision of water. It should be responsibility of government, but also it is a responsibility of communities. And I think that even in my community, government did not provide a source of water. We came as community members and then were able to raise a source of water, which is the borehole. So I think government has a portion of blame, but also community needs to take responsibility.
Well, from what...
By and large, we need to see to how we can come up with our sanitary policies as a country. Ayo Chambali, if you live in places like where I come from, you will discover that even within household, people are planting maize, guinea corn, trees that are quite tall. These are also breeding sites for mosquitoes. So why can't we have a policy to limit the kind of crops that we plant around
Dr.
our neighborhoods?
Dr. Ishaku, what ended that in the first place? Because if you remember, back in time, I think you have also referenced that earlier, we had sanitation officers at the local government level, all right, that went from place to place to ensure that, these things that we're talking about don't even happen in the first place. They ensured that the water you drank, they investigated inside your homes to ensure that the water you drank was safe and good enough for you. If you didn't have the right pot, the right water container, they trashed it and all of that. At what point did we lose that? And isn't that something that should be systemic as well? Just, we began with saying that.
I think what you are referencing on, we have not seen it in the last 20, 25, 30 years. When we have sanitation officers at local government level going to household to household to check. This is like in 25, 30 years ago. It's not obtainable now. You hardly see environmental sanitation officers at local government level. You even hardly can you see health educators officers at local government level. Hardly can you even see town criers, health town criers at local government level. So I agree with you. It's something that needs to be sustained. And I think we need to revisit such kind of policies. In fact, health educators, environmental sanitation officers will even be able to be part of policy formulations. We need their feedback from the grassroots, and then we do what is called bottom-top approach. Those are the things. So I agree with you that we need to sustain that. But you only sustain something that is happening or that is ongoing. We don't even have it. I can categorically tell you that in my state, I hardly see that. I hardly see health educators at local government level and environmental health practitioners at local government level. So we just need to look at these things. We are not only looking at
just a moment, Dr.
yellow
Ishaku.
fever. How about hepatitis E?
Just a moment, Dr. Ishaku. One of the issues also raised, by the Supervising Commissioner of Health in Benue State also revolves around risk communication. It would seem like communicating to the people in the first place for them to even understand the enormity of what they are contending with or the risks that they expose themselves to isn't even there in the first place. Now, that's definitely because already we have a good number of states, Bauchi, Delta, Enugu, a number of states are already battling with yellow fever now. And you say there are other risks that are out there that we are not doing anything about. So what should we be doing? We know that there are intervention groups at the state levels, and we also know that the NCDC at the center also has some interface with some of these intervention bodies of the state. So that issue of risk communication is there, and we don't seem to be doing enough. Or are we?
I think we need to do, yes, so I agree with you that risk communication is quite key. And when the Honorable Commissioner, Supervising Commissioner was talking about issues of belief and all what have you, I felt like the risk communication component of this health advocacy has not been done well. So I agree with you that there is no limit to public awareness about the health safety of citizens. So I think we need to do more. Maybe we need to re-strategize most of our risk communication strategy. But what is quite key is that we need to build capacity of risk communication and health education advocacy at the grassroots level. So I wish to prescribe this to the National Primary Health Care and even the NCDC, that we need to build capacity. We must not wait for NCDC to send rapid response teams to state. We must not wait for state to send rapid response teams to local government. What we need to do is to build capacity of a kind of a robust capacity at grassroots level. And once we achieve that, most of these things, we will be done with them. We need to also bring stakeholders, traditional rulers. We need to also bring faith, based organization. We need to also bring people within community and begin to build capacity. We need to change the dynamics, the strategy on how we do a lot of this health education. We are on TV now. Not everybody in the village can be able to have access to television, even have electricity. So we can begin to marshal out how we can be able to reach out to them. So Ayo Kayode, if I am in a remote area in Kaura Namuda and I have an MTN network and I want to dial to check my balance for my credit and I put *556#, I should be able to get a health communication message, because handsets, is closer to the people even than TV, even than, getting people around to come around. So we need to reject and do a lot of healthcare strategy in terms of risk communication. Is quite key.
Dr. Shako, I thought you were going to...
Even when we are formulating policies.
Right. Mm-hmm. I thought you were going to prescribe town crier, just like you said earlier, but maybe that's a cake. But let's take on Dr. Olai Oyiwana, pardon me, on some of these issues you have raised. You talked about capacity, which is quite important. And I'd like to find out, Commissioner, in terms of capacity, just how much do you have in Benue State? Because I was looking at a report that the NCDC released just before now regarding the situation report of yellow fever. And for Benue State, I saw that there were only 3 samples taken. That's test. I'm sure that's days ago. So that puts a big question mark on the issue of capacity. So how much capacity do you have in terms of sensitization, in terms of carrying out these tests, transporting them back and forth? How much capacity do you have?
Yes, initially at the onset, really the capacity may not really be enough. But since we got the sample test that this is actually yellow fever, the governor of Benue State has mobilized resources and we have built a lot of capacity since then. And as we are talking right now, the response teams, they are all over the local government, not just the target local government, but other contiguous local governments. And that, that the one that happened in Enugu State, for instance, is very close to Benue State. And even Kogi State, they have boundary with Benue State. So we have built a lot of capacity over time. As I'm talking about, a lot of caregivers have been recruited, even from the community. And then we launched a lot of massive campaigns in the area to make sure that this is exactly the way you should handle your issues in the state, in the local government. So we are enlarging our capacity. We are enlarging it to such an extent that this thing shouldn't just be restricted to the area in question, to the target area. The FLO community, for instance, where this thing started from, if you go to that place right now, initially, the boreholes that we are talking about, many of them were archaic. As we are talking right now, if you go to that place now, the borehole is flowing. In fact, I went there recently, I took the water, and then they also complained about other boreholes that were no longer functioning. The government is doing everything possible to make sure that they revitalize the boreholes. And then we ask them to bring able-bodied men and women. We'll train them on standard operational practices, and then we'll train them, we'll bring them on board to make sure that they are part and parcel of this campaign. And we are not
As
just,
it stands right now, Dr. Iwana, how many samples have been taken for testing?
As at yesterday, we took about 11 samples. As at yesterday, we took about 11 samples to NCDC for analysis. That is those that we, sometimes you have to suspect, you are not going to foreclose that this is only yellow fever. Since we are suspecting that it's viral hemorrhagic fever, we're also suspecting other ones like Lassa fever, but we don't pray that such things should come to our environment. So we are taking on some other samples, but by and large, the symptoms they are showing, everybody is showing, appears to be the same thing. So we are waiting for the result from the NCDC reference laboratory right now.
The samples you have taken, are they the same as the suspected cases you have? Because as at last week, you had over 23 suspected cases. So have you taken enough samples regarding the suspected cases in your state?
The sample taking is still ongoing. We are still taking, like I told you, yesterday we took 11 samples. Today, they will take samples. We will continue to take samples. And right now, today, we are going to launch a massive immunization campaign. And it is starting, the Benue State is taking off today. And we are going to launch it in 20 local government areas in Benue State. And the reason why we are launching, Benue State have 23 local government areas, but we are doing it in 20 because 3 has already been vaccinated in 2019. So we are doing it, it's only 20 right now. So we are taking, the sample taking is ongoing. And as we are taking it based on the people that they are bringing. And one of the reasons why you have this kind of figure, like I told you, 57, many of the persons were brought almost dead on arrival. They will wait until the dying moment before they bring the people to the hospital. But this kind of advocacy we are taking right now to make sure that when we even send them toll-free telephone number, give everybody in all the communities toll-free line. They will call when somebody is displaying any set of symptoms. You report immediately.
Okay.
The caregivers will go to that area.
All right. Well, Dr. Dr. Iwana, these diseases that you talked about, clearly they usually happen in the rural areas. Is that correct?
Mostly in rural areas for now.
Okay. Well, now, that also suggests that they are probably happening more in the border towns with other states. So, Benue State has, borders with a number of states, Cross River, Ebonyi, Enugu, Kogi, and Nasarawa as well as Taraba State. Are you having conversations with any of these state governments also to ensure that the spread is controlled so that it doesn't go beyond, Benue State? What kind of conversations are you having with any of these border states?
We've actually initiated a conversation with the Kogi State government alone for now, and we intend making a contact with Enugu State and all the other states that have borders with Benue State. And like I said, we just initiated conversation with Kogi State government, and we are trying to put our heads together to make sure that this thing doesn't escalate. And as we are talking right now, maybe today we initiate conversation with other states that are bordering Benue State.
Well, on a final note, Dr. Ishaku, you said that we're having an epidemic in a pandemic. Some have said we're not paying as much attention to yellow fever as we pay to COVID-19. So as part of your parting shots in a few seconds, what are the takeaways for us, really? What can we learn from our response to COVID-19 that we can now use for yellow fever?
So my parting words will be that we need to actually strengthen our surveillance system, just like the way we strengthen that for COVID. We need to also see to how we can be able to build capacity in terms of risk communication, even in terms of surveillance, in terms of disease notification, at grassroots level, which is quite key. We need to also come up with certain national policies. Ayo and Kayode, what stops us from saying that one of the, apart from your date of birth certificate, one of the eligibility criteria for you to enter primary school or a nursery school is for you to present your vaccination card. From there, we should be able to get children that have not yet been vaccinated. There are a lot of children that have missed vaccination in this country. And so if we come up with such kind of national policies, we should be able to target children that are quite vulnerable and be able to see to how we can be able to tackle most of these vaccine-preventable diseases.
We have to thank you very much.
See to how we can do research. Research is quite key. Yeah. And I think that we are not also looking at in the direction of other hemorrhagic fever like hepatitis E. So we need to see to how we can be able to, hepatitis E, Lassa fever, yellow fever, they have the same symptomatology complex. They present virtually the same symptoms, except for those, their route of transmission, that it is fecal oral. So I think as a country,
Akiala Ishaku, we have to thank you very much because we are completely out of time, beg your pardon, on this conversation, but your contributions have been most certainly significant today. Dr. Akiala Ishaku is a virologist and public health epidemiologist. He is currently a research resident fellow with Nigeria Field Epidemiology Training Program, support staff to WHO CDC, and is a lecturer, a senior lecturer with Biological Science Department of Nasarawa State University. Thank you so much for your time and your thoughts, as well as Dr. Godwin Oyewana, who is Supervising Commissioner of Health and Human Resources, Human Services in Benue State. He is also Commissioner in charge of Energy, Science and Technology in the same state. Thank you so much for your time and thoughts. Well, just before we go, a couple of comments coming from you, and both seem to be talking about economic recession.
Absolutely. But Joshua says Nigeria's economic recession is tweeting about that, saying that, why is Nigeria the first in West Africa to have nosedived into recession? Yes, COVID-19 is one of the factors, but government's inability to tackle insecurity, corruption, high cost of governance are what have crippled the economy. I don't think that's any help in there. The government lacks management ability, he says.
Well, Professor Enakena says, on the same issue, government must come out from the shackles of desperate economic policies to economic programs that will take the country out of poverty, provide enabling environment for investment, enact policies that are humane and capable of generating capacity for development and employment. Well, to comments and so many others, of course, you can check out yourself on our Twitter handle at Sunrise Daily Now. Until then, my name is Ayo Makinde. Have a wonderful day.
And I'm Kayode Kikilu. Thank you for joining us.